Dr. Wishnie, let's talk about the wonders of orthotics. I call them inserts. It's a much easier word for me. And I personally had some really good experience. I worked in the hotel business for a couple decades, and we're on the feet a lot there. During Christmas season, we're on the feet 15, 20 hours a day, non-stop. And somebody in Austria did give me orthotics, some doctor. I wasn't a podiatrist, was an MD. I don't think we have podiatrists in Austria. In any case, within 2 days, I had swollen feet. And I didn't know what's happening because I was doing this job for a long time. All of a sudden, it just went away. I don't wear them anymore. I wore them then for a long time, and then next thing you know is laziness. However, tell us about all the things an orthotic can help, because I have heard it can help with balance, it can help with avoiding neck pain and shoulder pain. Shed some light on it in a big picture, please. And definitely shed some light on it of,
sure,
there is the cheap orthotic, or let's just say the over-the-counter orthotic, and there is the custom-made orthotic. Is there really a difference? Because some of those guys on television, they make it believe, and maybe it's true, that it's as good or better than a custom-made orthotic by a podiatrist.
Right, that's correct. And it's a big problem for the public to realize, what the difference is between the devices. There's nothing wrong with the over-the-counter devices. They do help. But the issue is that most people don't know why they need an orthotic. They know their foot hurts, but they don't know what's going on. So let's talk about custom orthotic that we make. And we make you where we put your foot in proper alignment. It's a device.
If you don't mind,
sure.
Could you start off with what are some of the conditions this body could occur which could potentially be cured with orthotics? We know that this isn't a diagnosis because some symptoms, the same symptom has to be cured with something different, and it comes from somewhere different. Like you mentioned very well, if I had a ski accident and hurt my knee, that probably doesn't come from my uneven feet. But if I never had a ski accident and the knee hurts the same way than from the ski accident, it could potentially come from an uneven foot. So shed some light on all the symptoms it cures, please.
Okay. I would say about 85% of foot problems are due to poor alignment. So, such as if you look at heel pain, which is heel spurs, or plantar fasciitis, any kinds of tendinitis or tendinopathies we call it, or inflammation of tendons. We have loads of tendons in the foot, and it's Achilles tendinitis. There's a tendinitis on the inside of the foot and the outside of the foot, all due to improper mechanics, the way the foot's functioning during your gait or while you're walking. Okay, any kind of joint issues. So a lot of people sometimes have pain in where the toes meet the foot in this joint over here because, again, improper alignment. Early bunions. And that will help eliminate some of the pain and prevent the progression of a bunion. But also people come in with, like you said, hip pain or lower back pain or knee pain due to poor biomechanics, the way your foot's functioning. Also an orthotic will help you. So that's where a custom orthotic is totally different than the over-the-counter in the sole. Okay, even if you go to like Walmart or some pharmacy and you stand on this machine, all it's doing is saying, okay, your foot has a high arch or your foot has a low arch, and now go pick this type of insert, which is right next to it, like from Dr. Scholl's. It's okay, you need this insert. Now go pick it up. Now, no 2 feet are alike. No 2 snowflakes are alike. No 2 feet are alike. Not even your own 2 feet are alike. So when you have something you're pulling off a shelf, it's not made for your foot. It might fit in your shoe, it might feel comfortable inside your shoe, and you might just have purely a cushion problem, where you don't have enough tissue, enough skin on the bottom of your feet, and you're walking on the bones. All you need is a nice over-the-counter, comfortable insert that'll take care of the problem. But if your problem's due to heel pain and tendonitis and bunions or knee or back problems, that's an alignment issue. And so you need something made specifically for your foot.
Let me ask you something, Dr. Wishnie. I have spoken to a dentist, and he has talked to me about TMJ, basically the jaw's out of alignment, and dentists fix that. And the most important thing is we're not usually talking the pain in the jaw, we're talking the migraine, the excruciating migraine, shoulder pain, and other headaches. Now, here's what this particular dentist said. He says very often, yes, he fixes part of the very main thing, but he says actually it didn't originate there. It originated in the foot, and I need to send the guy to a podiatrist because otherwise everything I fix a month or two or whatever later goes out wacko again, and he's back in the same place. And so he is working with a podiatrist and in many cases with a chiropractor because everything it gets so out wacko that it all has to be adjusted, but it doesn't do any good if the feet weren't adjusted. That's what this dentist says. Now, is he way off here or what? What's the deal?
No, he's not off. The whole body is one unit. Okay, it works together. So one thing's out of alignment, another thing's out of alignment. It's that whole song, the ankle bone's connected to the leg bone, connected to the hip bone, that whole song. And it's so true. So if anything's out of alignment, now I'm not going to tell you that an orthotics is going to cure every TMJ, but you have that dentist like you had talking about who actually looks beyond the person's mouth and sees what's causing the headaches and says, okay, I can fix this, but you're also out of alignment here or there. We need to get everything back in place. And we have, I work with a lot of great chiropractors, orthopedists, physiatrists, all of them just really understand this, that the body is one. And we're not just being focused very narrowly just on that foot problem. We are looking at the person as a whole. And so, yes, that's definitely can help.
All right. So basically, the orthotic insert is there to balance the foot a little bit like when you get a wheel alignment on a car, because without it, not only do your tires go bald in one side, the car doesn't sit. It can easily, be thrown out. And of course, other issues in the car, the ball bearings, everything will wear out simply because you had a misaligned wheel in the first place, and that's basically what you're saying. So
exactly.
Good. And you do say that a person can start trying some custom-made orthotics, and if they help him, fine. But if he kind of sees things are coming back, they feel comfy, but then he should just go and get a thorough examination and see whether a custom orthotic will do the trick, because it looks like the most important thing is not the money you save, which although if the pain doesn't go away, let's say you have headaches, what good does it do, right? That's basically the idea there. And so
I have patients I have patients all the time that come in with a bag of over-the-counter orthotics, and they could cost you a lot of money eventually. And even in my office, we have an over-the-counter type of orthotic because, again, not everybody needs a custom. So we don't our philosophy again is we fit you with what you need, exactly what you need, and to get you better now.
Somebody might only need a little bit of an arch support, and then that's fine. Give it to him, and all he needs to do is pay for that because it's there. I got it. Beautiful. Well, Dr. Wishnie, it starts at the feet. Makes sense, we are standing on them all day long, and if it starts getting uneven from there, we're not so happy walking on a road which is uneven,
right.
So to the same distance is a fit. Wonderful. Thank you very much.